Okay, so it's Oscillopsia. You see a static macular edema. Looks like you have glaucoma even though you have low eye pressure. Positional dizziness. And here's the thing, you can't get your bite right. So you've gone to 8 different disciplined dentists and an orthodontist that are using different schools of thought when it comes to the bite, the mouth, and what's more important, what to prioritize. And we did find through the physical exam and adjustments that this intimate relationship between your jaw and your atlas is neurological in nature. There seems to be an inhibition of muscles in the cervical cranial junction that are related to this jaw. So to oversimplify it, it seems that what they're prioritizing in the jaw to make it straight, it has to be a certain way to accommodate the atlas, which is the cervical cranial junction is significantly distorted, and it seems like a cart and a horse. The horse is the mouth that's dynamic, and the cart is this atlas that's in relationship to it. So yeah, we found out that you go out of adjustment, well, with left head rotation, because your atlas has a tendency to go up to the right, but more so when the bite is in different orientations. So we tried putting your bite in different ways, different splints to find out, and actually we got some great x-rays of what happens when you take one of the splints out. This whole thing moved like a degree towards the correct direction by changing splints in the mouth. And of course, the wrong movement with your mouth knocked the atlas right out. All right, so that's with you lying down. I've got a screenshot that tells a story, and we'll try to do this in an efficient manner. So there is jugular vein compression. The radiologist called it severe on the right, mild on the left, 80% on the right, 50% on the left. So here we're seeing dilation and accessory veins trying to accommodate a little bit of that there. Here you can see the atlas going up to one side. You have a dominant right vertebral artery that seems to cross the midline, and we're wondering if that's in play. We see this, sometimes that's an issue with these hypermobilities. We just documented it with a bunch of different shots here. Okay, and here we are looking at you from the front. You can see how far the atlas goes up to the right. Now, I don't think it'll ever be down towards level. I think you're just born with some anatomical variant in there, but it does let you know that you can't turn your head you're vulnerable when you turn your head to the left. When you turn your head to the left, the atlas goes further to the right, and we got some great shots of that. There's another picture to give you context. So yeah, your whole spine looks pretty straight, and then it comes to this atlas. And that seems to be what's going to get you across the finish line, learning how to manage this misalignment. Another shot of that vertebral artery. There you are, neutral. This green line represents the center of the foramen magnum, which is the hole at the bottom of the head. And you can see how it goes off to the right. We also ended up adjusting a little bit anterior because there's an anterior head carry there too. And that ended up working out well for us towards the end. So this is left head rotation. You can see the atlas slides up to the right and rotates. Oops. So left head rotation, right head rotation. With right head rotation, you move towards the midline, everything kind of straightens up. And left head rotation, you're vulnerable. So if you're in a dental chair, which I'm not blaming a dentist, but they don't know, they're concentrating on the dental work. It just seems that you don't want to be turning your head to the left and having your atlas slide up to the right and then having a lot of dental work done. You want to have your head turned to the right, so you're more vulnerable, you're less vulnerable, you're more stable. You know what, we did really take an inventory of that to see if you were hypermobile, and you look pretty good. Normal anatomy, your anatomy. Yeah, there were some interesting structures out there that, I mean, we ended up 3D printing it to see how it plays out. Some bony protuberances here, and this, of course, houses the neurological structures, the brain and the cord. And this shows that severe jugular vein compression pretty good. you know, the arteries and veins are in the way, so you don't really see much there when it comes to the tilting. And there's your 50% on the left side. So we have some hypermobility, just a little bit. We have aberrant movement because of your bony anatomical variance. You know, we looked at a bunch of this stuff. That's actually, okay, this is before and after. This is after day 2, after the adjustments, and you have a certain appliance in your mouth that we seem to, at least it keeps you from going out of adjustment. This is one that I thought was interesting. Again, when you first came in, and then when we took the dental appliance out. So my heart goes out to a good, well-meaning doctor who's going by what they were taught and doing everything that's supposed to be the right thing, and just prioritizing the wrong thing for you. So without the dental appliance, you go from 4.73 degrees of an atlas subluxation down to 3.22. That's before we ever touched you, just taking that up. And with left and right head rotation, you go weak until the correct dental appliance is in there. Then you can turn your head left and right and not go weak. And then, of course, we played with different vectors to find out what's best. You know, airway. So is there does the body react to a compromised airway? What are these reflexes that we're dealing with? There seems to be some sort of a reflex between the skull and that atlas and the jaw, that getting that bite right. So is there anything you want me to talk about? Anything you want me to speak to? Okay. Thank you very much.